Now, I introduce José Antonio Ale. Thank you, José Antonio. He needed liver transplant, and I will present the clinical case. Afterwards, he will answer some important questions, and we will finish with some conclusions and comments about his liver transplant. The natural history of NAFLD is a progressive disease. I suppose he started with steatosis and little by little progressing fibrosis. He had cirrhosis, and his liver developed hepatocellular carcinoma and needed liver transplant. Receiving a liver transplant is a challenge situation in the cirrhotic with NASH. And they have challenges in the pre-liver transplant period, during the transplantation, and after liver transplant. So we will have the presentation in 3 parts. And I start with the clinical record. And thank you to share your data. She's now 65 years old and received liver transplantation in December 2013. He had obesity starting in adolescence and always was on hypocaloric diet. Alcohol use was very, very low and occasional, not tobacco, and while he had an active working life as a teacher and director of one school, and a normal familiar life and social life. In 1982, he suffered a flare of hepatitis of unknown etiology, and he followed controls, medical controls, and follow-up. And was in 1989, he had a slight lab alteration about ALT, SAT, lipids, but the ultrasound, they detected diffuse liver disease. And in 2010, labs were hepatitis B, C, and autoimmune negative, and detected very low platelets count, 52,000, with preserved liver function. But in the abdominal ultrasound was the diagnosis of signs of cirrhosis in this moment. He followed controls, and in 2012, a new ultrasound detected a lesion 33 millimeters suspect of HCC. They realized fine needle aspiration without finding malignant change. So they follow the controls, and at the beginning of 2013, he was transferred to another hospital. Was referred to a big hospital with liver transplant program, and the diagnosis in this moment was NASH with progression to cirrhosis and HCC that increased size from 3 to 5 centimeters, showing an atypical image on radiology. This means that the multidisciplinary team decided that liver transplant was the only therapeutic option, but he needed a tumor biopsy that it was confirmatory. He met liver transplant criteria and was accepted on the waiting list. During this period, he received 2 treatments with transarterial chemoembolization in order to stop progression of the tumor and be remaining in the list. At the end, he received liver transplant at the end of the 2013. This is the image of the progression of the disease. You can see these white spots are fat, and little by little, the deposition of this thing of blue color. You can see this is the scarring liver, this is fibrosis, which is progressing until F4, cirrhosis, the last stage. That does mean cirrhosis, and sometimes before this type of liver disease is related to the risk to develop hepatocellular carcinoma. Now we have these important questions that after a very good conversation by telephone, José Antonio shared your perception and your experiences and your attitude, and that is very important to share with us. Thank you. You can read.
I'm very glad to share my experience with you. How did I perceive my quality of life? Well, at the beginning, really badly. Then, well, and at the end, really, really badly. I had anxiety. What's going to happen to me? At the beginning, really badly, because physically I felt well, but well, I had a hepatitis that is a disease with a bad reputation because it is associated with inadequate lifestyle habits. Afterwards, the hepatitis got worse. Then I had hypertension, psoriasis, glaucoma, back problems. Those were rough years. But little by little, the disease didn't disappear, but it became kind of normal. But I thought, okay, be careful, because the disease is there, and anytime it can get worse. So I had a relative good quality of life with nuances. Fortunately, my lifestyle before, well, I didn't drink. I drank a little, I smoked a little. So I could stop drinking and smoking at all. That was easy, but from a social point of view, it was difficult because, well, socially is not good to reject a cigarette, to reject a drink, an invitation for a drink. So if you say no, I'm not drinking, and then you say that you have hepatitis, that's even worse. But today we have beer without alcohol, free alcohol beer. That was a good alternative. And then the person who invites you for a drink doesn't get offended. On the other hand, I didn't know the cause, the type, I didn't know anything. And then, well, years went by, and it was okay, but then cirrhosis came. And of course, I nearly panicked here. What I knew about cirrhosis is that people who had cirrhosis didn't normally survive. After that, cancer. And then, no definition of the type, nothing. So I became anxious, and I thought, your clock is going to stop working. Well, I'm just a little emotional. Well, this is normal. Esta experiencia es tan importante que ELPA planifica participar en el mes que va a ser el mes de la información sobre el carcinoma hepatocelular. Y este vídeo debería utilizarse para compartir con todas las personas para aumentar la concienciación de esta complicación tan importante. Así que muchas gracias.
¿Cómo reaccioné ante esa situación?
Well, how did I react to that?
Pues, digamos que dos expresiones coloquiales para
Well,
definirlo.
two expressions would define
Que la
that.
percepción va por dentro,
You keep your problems to
y
yourself
otra,
is one.
al mal tiempo, buena cara.
Another one, every cloud has a silver lining. That's the only way. So I moved on working.
Llevando la vida con la
I
misma
led my
normalidad que
life as I used to
siempre,
do
tenía que ir más veces
before.
al médico.
I had to go to the doctors more times, but that's it. I didn't change anything in my routine, in my daily
Y
life.
solamente conocía la gravedad de la situación.
I knew that the situation was serious, and the only people who know about that was my wife and my two elder sons.
Me lo reprocha todavía.
My other son is still angry with me because I didn't tell him about it.
Era preocupar a la
I
familia.
didn't want to worry my family.
Cuando la gente sabe que
But
está
when
mal,
people know that you are sick,
quería evitar cómo estás y demás.
they just ask a lot of questions. How are you?
El objetivo.
And I just wanted to avoid all that.
Otro aspecto a comentar es la información que tenía.
What about the information I had? Well, at that time, we didn't have access as we do today.
Me proporcionaban los médicos.
The only information I had was the one I got from doctors.
Hepatopatía
And then, of
de origen
course,
desconocido,
diffuse
pues,
liver,
tampoco ellos tenían
diffuse liver disease, and well, I didn't know anything else
Así que
about
más
that.
allá de saber qué es una hepatitis o una
Well, I knew what a
cirrosis,
hepatitis
lo que había
was or
en la
a cirrhosis was because I read in the encyclopedia,
estaba en el ámbito profesional.
but the rest remained in the with professional people.
Si estaban haciendo
And then,
todas las
what could I
pruebas
ask
que podían
doctors if
y
they
no
did all
encontraban
tests
resultados?
and they didn't get any results?
Confiaba en lo que estaban
I
haciendo
trusted
y
them,
mientras la situación era aceptable,
and while the situation was acceptable, I lived with it.
mucho más, vamos para adelante.
I couldn't do anything else.
Comentar también la gestión con respecto
What
a,
about
como comentaba, había otras enfermedades.
the management of the other
Hasta
diseases?
que no llegué a
Well,
la unidad
until I
de
didn't get
trasplante
to
del hospital,
the
es
unit of
cuando
pre-transplant
sentí que era un único
at the
paciente
hospital, I felt I was the only patient that had many
que la controlaban
diseases that
diferentes
were
especialistas,
controlled by
pero
different
coordinadas por una
specialists
persona, por
and
un equipo
coordinated by a person or a team
hasta
that
ese momento
united
era yo
everything.
el que estudiaba los prospectos de los diferentes
I studied everything about the diseases, all the instructions or the leaflets, and then I discussed them with the doctors. But that was the only thing I could do.
Bueno, y hay algunos detalles, como es el caso
Excuse me.
del sudor.
The thing about sweatiness, for example, well,
Es que en mi caso,
we didn't discuss about that. They took no notice of that. Sweat? Well,
así que yo hago una pregunta, ¿sería posible generalizar el
so would it be
sistema
possible to
que
generalize the system at hospital
en toda situación?
for all the patients in all situations? I wish.
Cosas que se pueden tratar de forma
A lot of things
independiente, pero están todas
could
en
be
el mismo cuerpo,
treated
que es como
separately,
que
but
es la
all of
misma
them are in the
persona
same body
que
of a
piensa,
person who thinks, who feels,
preocupaciones necesarias.
and who is worried about what's happening to him.
Quiero tocar también la obesidad y la gestión
Obesity, what about
de
that?
ella. La obesidad y el índice de masa corporal.
Obesity and body mass index is very important in this disease and in many others. In my case, I'm 1 meter 84, and my weight was 115 kilos. So I was type 1 obese. And then I had like 100 kilos, so that was obese. So if I had this disease type 1, well, the ones that have a higher score, they are going to be worse than me. So the more risk, the higher, the more risk that you have to get sick. In my case, the management of obesity was lousy. I wanted to reach 90 kilos, but it was not possible. And my opinion about endocrinologists, dietitians, leaves a lot to be desired, because the information and the adaptation of the diet to each patient was zero. And I think that the most efficient is not giving you a photocopy of a diet and say, okay, you just have that, and that's it. Well,
ejemplo del desayuno típico.
For example, for breakfast,
Un bizcochito de 50 gramos con un poquito de
50 grams
y un café
of
con leche
bread
desnatada. Eso a
with
las 8:30
some
de la
cheese
mañana.
at 8:30 in the morning,
Eso a las 3.
and then have lunch at
Hubo uno
3.
que me permitía tomarme una fruta
Some doctors allowed me to have some fruit mid-morning, some of the allowed fruit.
que es imprescindible conocer
But I
el
think it's
estilo de
essential to know the lifestyle, the work, the job, the life of the patient, and then adapt things to the patient gradually for the quantity also. Of course, doing exercise is mandatory.
Al final, ¿qué es lo que me resultó más efectivo para
Well, the most effective to lose weight was
Lo único que fue efectivo, no me produjo un rebote al alza como
the most
trabajaba
effective
siempre, fue primero quitarme la presión de
was
de la
not to have to weigh myself every day,
empezarme diariamente a hacerlo semanalmente.
and then I just did it once a
Comía
week.
3 veces al día,
I ate 3 times a week.
5 veces.
So now, from then on, I had 5 times eating. Then
Comidas grasientas,
I had to
todo
avoid fatty
con
foods,
eso llegué a los 100 y me mantuve ahí sin problema.
and then I got to 100
Ahora
kilos.
conocemos que esos son hábitos de vida
Now we
saludables.
know that these are
Parece que en aquel momento era
the healthy lifestyle habits.
respecto a la actitud.
What about the attitude?
Pues mi actitud es que yo prefiero ver la
Well,
botella medio
I
llena
prefer to see the bottle half full rather than half empty, because it's healthier, it's more gratifying when you are positive.
Hay que ser consciente de la
You need to be aware of reality,
hay que ser proactivo.
and then you need to be proactive, and you have to do your best.
Yo siempre digo que antes o después a todos se nos van a
Sooner or
apagar
later,
los relojes.
all clocks are going to stop working.
Funcionan más aquellos
But
que estén más
if you
cuidados.
take care of them, they are going to last longer.
Para mí cuidarse es prioritario.
To me,
Pues llevando
taking care of myself is a priority,
activo,
and you need to be
disfrutando de lo que
proactive, positive, have a healthy lifestyle,
más joven.
and be in the company of, enjoy the company of the people, the older people, the younger people.
Respecto al trasplante de hígado y el impacto,
About the transplant and the impact that it had on me, I have to say
repito que tras el diagnóstico de cirrosis,
that what,
una
after the
reacción
diagnosis
hepática,
of cirrhosis,
pánico, angustia,
and then I panicked, I had anxiety, and if the carcinoma was confirmed, I had the possibility of a transplant. So the confirmation of the carcinoma opened like a door to me, a solution. In my case, transplant was equal to solution. It wasn't going to be a bed of roses, but it was a solution. So confirming that diagnosis was a beacon of hope. What helped me the most at the moment? Well, although it seems little, the visits of the members of the Association of Liver Transplant Patients was very helpful. It was very nice to talk to them because you saw that it's possible to overcome. It was really, really good to talk to them. The management of the time while I was on the waiting list. Well, waiting gets you down, they say. But in order not to despair, you need to be active and do the same activities as before. Physically, I could do it, so I did it. Physically and mentally was very good for me to move on and to go on working. After the transplant and the adaptation, the follow-up, that was excellent. Either the scheduled program or the times that I had to go to hospital because of other reasons, because I had some problems. For example, I had a herpes in all over the body, for example, and then I had to be hospitalized. So here I am again, and that the treatment was good there. Well, to finish, I need to say that I need to express my gratitude to the donors, their families. Without them, I wouldn't be here. And the medical team also, I thank them, and my family. Thank you very much.
Muy bien, muchas gracias. And now the conclusions. You can see José Antonio with NASH, cirrhosis, and hepatocellular carcinoma have been cured with the liver transplant. And José Antonio enjoys good quality of life. He lost weight and maintained, and that's all. Thank you very much. Muchas gracias.